disease. See, a 30-year-old female patient presents to the OPD with chief complaints of fatigue, tiredness, irritability, constipation along with abdominal pain. Patient seems to have facial pallor. Patient also complains of irregular menstruation. There is blue line on the gums seen on the upper jaw. There is wrist drop and foot drop also, which is present in the general physical examination. On further lab investigations like CBP, her HB level is 8 gram per deciliter. On further investigations like histopathology of the blood, you will see a blue dot which is seen on the RBC. On X-ray of the long bones such as femur, opaque dense bands which are seen at the metaphyseal ends. What further investigations and treatment is needed in this case? So first of all, look for the age of the patient and which gender, like she is a female, okay, and she complains of fatigue, tiredness, irritability. So it might be, and on CBP her HB level is 8 gram per dl, so she have anemia, okay, and she also have constipation with abdominal pain. So and also she complains of irregular menstruation. There is blue line on the gums. So this blue line is known as Bartonian line, which is seen on the lead poisoning, okay. This line will be mostly seen on the upper jaw, okay, upper jaw side gums. You will see this blue line, okay. So how we will examine? So we will throw the torch on the mouth of the patient and will appreciate. So general physical examination from head to toe examination. So after this eyes, after nose, after when you come to mouth, you will see this Bartonian line. After that you will appreciate neck. After that you will appreciate hands. So on hands you will see wrist drop. On the foot you appreciated foot drop also. So and CBP you saw her hemoglobin level as 8 gram per dl. On further investigation you saw blue dot. So blue dot means it is significantly showing it is basophilic stippling is seen, okay, and HB level is 8 gram per dl. On microscopy you will appreciate microcytic anemia, okay, microcytic hypochromic anemia it is. So on X-ray of the femur, opaque dense bands which are seen in the metaphyseal ends, which indicate there is chronic lead poisoning, okay. If the lead poisoning is occurring greater than 4 weeks, then you will appreciate this opaque bands. So what are the further investigations you will see? So and see you even saw irregular menstruation. Sometimes the patient, if she is 13 or like if she is 16 and she is complaining, I didn't get even my menstrual period, then you should suspect lead poisoning in that case also, okay. So amenorrhea they may complain of, and there is pallor, as you see anemia is there, and blue dot indicates basophilic stiffling due to the inhibition of 5' pyrimidine nucleotidase enzyme, okay. And see lead actually you know the iron pathway, right? So first divalent metal gated channels they should open for this. So in that iron is also Fe+2 and lead is also Pb+2. Then it competitively inhibit the iron, and it lead it also inhibits the aldehydatase enzyme and ferrochelatase enzyme. So these enzymes are inhibited, and so heme synthesis pathway is disturbed, right? So and the protoporphyrin levels, zinc protoporphyrin levels will be elevated there. So you should ask for serum zinc protoporphyrin levels, urine porphyrin levels, how are there, okay. So you should ask for that. And treatment per se you should say BAL, okay, British anti-leukemicide, along with the DMSA, dimethyl succinic acid, okay. Okay, this is the treatment, okay. That's all, guys. First, whenever any case of poisoning comes, we should ask for the occupation of the patient, because they may be in the painting companies, or they may be working and accidentally ingesting the paints. And the age also important. Sometimes the children, they may be playing with the toys which are made up of the lead, and they are keeping them in the mouth, and it may leads to poisoning, right? So and constipation also significantly you should see, you should examine abdomen also for that. So what other features you may appreciate like that. So this Bartonian line is especially will be seen in the lead poisoning, mainly on the upper jaw. Okay, so you should appreciate, and you should see basophilic stiffening also in these cases. You should see urine porphyrin levels, zinc protoporphyrin serum levels in this case. That's all, guys. This is about lead poisoning. Be cautious about the age, gender. Gender means both female and male complaints of amenorrhea. Okay, here I mentioned irregular menstruation because she is 30-year-old, and that's all, guys. Today onwards, we will discuss some cases if possible, and we will continue with ophtha also. Cataract, we should continue it. Mm. And FMT topics also, like these cases I will be mentioning. Okay, guys, thank you.